Dark spots, uneven pigmentation. This can be caused by a lot of different things. They can be age spots, liver spots, seborrheic keratoses, melasma, and for most of them, the treatment is actually very similar. They develop because your skin wants to make brown. And if you naturally have pigmented skin, this is oftentimes more common, but even people who are really pale like me can have a genetic predisposition to make these brown spots. The best way to slow down their development is to wear sunscreen every day and really minimize your exposure to the sun. In addition to that, it's about promoting cell turnover to really peel off that top layer of brown so the spots never get so dark. So the easiest way to do this at home is using a vitamin C serum in the morning. It can be my day preventative treatment. It can be C&E ferulic, but you need something with vitamin C that's going to really lighten up the brown. You follow that with a mineral-based sunscreen. Zinc seems to be the most effective of preventing the formation of brown. I like it to be at least an SPF of 30 and have at least 10% zinc in it. Then you reapply that sunscreen during the day, and at night you want to use something that promotes cell turnover. This can be my night repair treatment that has bakuchiol and glycolic acid in it. It can be prescription strength tretinoin. You just need something that's going to help peel off that brown in addition to what you did in the morning, which will hopefully prevent you from making more brown. So that's what you can do at home. Now, if you go into the dermatologist, there's more that we can do. You can have peels. Chemical peels are going to lighten up your brown quite nicely without the risk of heat. The heat and lasers can make some people's brown worse, so you want to be careful what lasers you use. One of the safer ones to use is a gentle resurfacing laser, like a Clear and Brilliant. That, for most people's skin types, will not activate the brown. We also can prescribe you bleaching creams that have hydroquinone in them, which you cannot use year round, but is quite helpful for lightening brown. For people with really bad melasma, there's actually an oral medication called tranexamic acid that also will lighten brown. The oral form seems to work much better than the topical form, but the topical form is also available. And then even if you get a laser or a peel or use these bleaching creams, the brown will come back. And that's what you need to know, is we cannot take away the genetic predisposition to make these spots, but with good hand holding and meticulous care at home, you really can make them quite light and keep them that way.